morning and welcome to the show. The topic this morning is minorities and health services. And we've been joined by two very distinguished doctors from Meharry Medical College. With me is Dr. CJohnson, who is the former Dean of the Graduate School and Vice President for Academic Affairs Emeritus at Meharry Medical College, and the present Dean of the Graduate School and the Vice President for Academic Affairs at Meharry Medical College. And let me welcome both of you to the show this morning.
Thank you.
Dr. Johnson, quite recently there was a very, very important meeting held in Nashville here, bringing together a number of doctors from throughout the nation. And I think it was also sponsored by Tennessee State University, Fisk, and Meharry. And I also understand that you had quite a responsibility in starting that entire institute. And so why don't you start us off this morning by giving us some information about that institute, and Dr. Jones can give us some information relative to what happened here in the recent meeting.
The event that you mentioned was a national symposium sponsored by the National Institute of General Medical Sciences. And that's a funding body of the National Institutes of Health for two programs aiming to increase the number of minorities in the biomedical sciences, as well as to increase the amount of research. The two programs in question, the Minority Biomedical Sciences Program and the MARC program, or the Minority Access for Research Careers Program. The one with which I had the greatest association was the Minority Biomedical Sciences Program, which started, the first grant was awarded in 1972. And we had had some earlier contact with individuals who dreamed up this program and who originated, in essence, who had come to Meharry as well as to other schools throughout the country, and they talked with representatives from Fisk and Tennessee State University to get some input as to how they would arrange the program. It was particularly gratifying to me to see how the program has grown in these years. We were one of the 38 original institutions to receive an award. There were 38 schools to receive initial awards, and Fisk University was one of those. As I recall, Fisk funding was on the order of about $500,000 over a 3-year period, and Meharry's was about $800,000 over the same period of time. I had the privilege of being the keynote speaker at the banquet, and it's probably one of the most exciting periods of my life to sit there and to see this tremendous group of young folk, mainly students, and there were their mentors. There were some representatives from the federal government there also, but at the banquet there were more than 1,500 people there, representative of the total size of the conference, which I think was about 1,600 to 1,700 folk. And it was exciting to see all those bright faces and these enthusiastic folk coming from all over the country and from Puerto Rico too. When we started this program, it was started with only $2 million, and to have grown and to have been sustained throughout the years was a very satisfying sort of experience for me.
Very good. Dr. Jones, I would imagine that you saw that same conference from a different perspective, because I think it was your responsibility to sort of coordinate and organize it this time around. Why don't you tell us some of the problems and some of the successes?
Yes, it was really
involved.
A gratifying experience. Having been program director, the MBRS program director at Meharry from 1978 to 1987, it was long my desire to have the annual symposium here in Nashville. Other cities had been successful in having the event: Atlanta, Los Angeles, Washington, D.C., and we could never have it here in Nashville because we didn't have the hotel accommodations. And for several years I worked with the NIH to see if we could bring that meeting to Nashville. And I was elected chairman of the National Program Committee and presented the proposal, which was accepted, to bring the symposium to Nashville this year, and we were very pleased to have it here.
And so each year they meet at a different place, and we were successful enough through your efforts to
in the past they've remained in some cities 2 years or 3 years. It started in New Orleans because of the association with Xavier University, and it remained there for 4 or 5 years or more. And from there to Atlanta and Los Angeles, Washington, and we were fortunate to have it here in Nashville this year. Really a very pleasant experience. And it was a big boost to the institutions involved. As you have mentioned, it was co-sponsored by programs at Tennessee State, Fisk University, Meharry, and there's also a MARC program at Vanderbilt University as well.
Very good. Dr. Johnson, I would imagine that one of the areas that the conference addressed had to do with the shortage of black healthcare workers in this country. Let's talk about that. Let's the three of us talk about it for a few minutes. What is the status of health care in this country for minority groups?
Well, it's abominable, really. Today, every year, there's 60,000 black folk who die, who would not die if they were white and had the same level of access to the health care system. Today, a black child is twice as likely to die as a white child. And that child's mother is 3 times as likely to die in pregnancy or in childbirth as the case would be for white mothers. I think there's an overwhelming preponderance of the incidence of AIDS among black folk, of fatalities from things like diabetes, hypertension, and homicide. The American dream is somewhat different for those folk in the mainstream and people who refer to themselves as African Americans.
Very good. Dr. Jones, as the Vice President for Academic Affairs at Meharry, you're probably developing programs to perhaps deal with some of the problems that Dr. Johnson has pointed out. Now, what are we doing in that direction? How
yes,
successful are we?
there are several programs. Let me start by talking about the MBRS program, which sponsored the symposium, in part sponsored the symposium that we had recently. I'll talk first about the shortage of black biomedical scientists who are doing research on the various diseases that disproportionately impact on the black population. That program, the MBRS program, has been instrumental in providing support to train biomedical scientists and to initiate research at minority institutions. As Dr. Johnson indicated, he started with a very small proposal in 1972, and we're to the level now where we're supporting some 18 research laboratories and about 30 graduate students training for the PhD degree in the biomedical sciences. As you look at the demographics now for the year 2000, thereabouts, greater than 50% of the workforce will be comprised of minorities and women, and they will be black women. And it's estimated that as you look at the pipeline, those who are training, we won't have adequate numbers to meet the needs. We don't have adequate number of trained biomedical sciences as it is now to meet those needs, and the shortage is going to be very critical in years to come. So these programs are very important to try and increase the number of minorities that are involved in biomedical research, and to focus on some of the research problems that disproportionately impact on blacks. This morning at Meharry Medical College, we had a conference, Diet, Nutrition, and Cancer. Cancer is one of the leading causes of death among blacks. The contributory factors are diet, lifestyle, which includes cigarette smoke and alcohol consumption. It's important that we educate our people and those who train as physicians and dentists to the importance of diet, the impact of lifestyle on this major cause of disease. We have a number of community programs that are aimed at addressing that same problem. The Cancer Consortium at Meharry there, which is a joint venture involving Meharry Medical College, Morehouse School of Medicine, Atlanta